Thousands of state workers have a new contract and they're not happy about it. The State Civil Service Commission approved those contracts today. The two-year deal includes a modest bump in pay but increases in out-of-the-pocket health care costs. Anthony Sabella has the details.
Last month, this was the sight outside as the Civil Service Commission voted on a new state employee contract, ultimately landing at a 2-2 tie. Fast forward to Wednesday, and it couldn't have been more quiet as Commissioner Robert Swanson changed his vote.
It is a far worse situation to leave state employees vulnerable with no contract. I think that what we're doing today is a travesty.
UAW Vice President Cindy Estrada couldn't agree more.
We came to the table with $24 million in a way that they can save costs. Instead, they wanted to shift that cost to workers.
The new contract includes a 2% wage increase in 2014 and 15, along with a 0.5% lump sum payment this year. However, it also increases co-pays, deductibles, and out-of-pocket maximums for more than 30,000 state employees.
When their revenue is over $1 billion, there's not a need to ask for concessions from workers.
But the state argues that about 2/3 of the revenues announced last week are one-time and shouldn't be considered for a long-term issue like health care.
Then you've got to go back time and time again, year after year, to find that money again.
Jan Winters, the director of the Office of the State Employer, says the decision is a win for the state, but adds negotiations can go better in the future.
We've heard from both parties. We're ready to work together. We're ready to go to those joint health care committees.
We'll continue to encourage the state to sit down with workers and treat them with the respect and dignity that they deserve.
In Lansing, Anthony Sabella, Fox 47 News.
The two sides were supposed to meet between the last meeting and this meeting to try to reach some kind of agreement, but had no progress. The details of the contract were recommended by a special state panel after the state union reps could not agree.